Since it is summer season, there are some general tips that we recommend for patients to follow. If a patient can limit their exposure between the hours of 9 a.m. and 4 p.m., that's when the sun's rays are the highest during the day. But being in Charleston, South Carolina, that's difficult to ask patients to do. So some other things that we recommend is, one, applying sunscreen. And what patients should look for is a sunscreen that is broad spectrum, that covers UVA and UVB. At least an SPF of 15. As long as you have an SPF of 15, you're getting sun protection. SPF of 30 would be most ideal in this location. And having patients apply that 15 to 30 minutes before they go outside. The key, though, is once it's applied, is reapplying it if you're going to be outdoors for an extended period of time. Particularly at the beach or at the swimming pool, sunscreens wear off. Water takes away the sunscreen, and also part of what the sunscreen is doing is absorbing the sun's rays. And as it absorbs the rays, it wears off. So we recommend reapplying the sunscreen every 2 hours. And another important point is being liberal with your application, applying as much of it as you can. The studies have shown that patients generally don't apply enough to the areas. So be very liberal with your application. And cover up. Have a nice hat, broad brim hat, long sleeves if you can tolerate that. But if not, protecting yourself with sunscreen is very important. The important point when you're on the water is you're getting more reflection from the sun. And so you want to apply it to any area that's exposed. And some common areas that you don't even think about is on the neck or below the chin as the rays are reflecting off the water. But also wearing sunglasses that have some protection from the UV. 90 to 100% UV protection is what you're looking for. Because not only is the skin getting some UV damage, but also your eyes. Another common question we get is, I have a child, should my child wear sunscreen? The American Academy of Pediatrics and American Academy of Dermatology have recommended not using sunscreens on children less than 6 months of age. But studies have shown that small amounts of sunscreen are tolerable. So if your child is going to be out during the hours between 9 a.m. and 4 p.m., try to keep them covered. But areas that aren't covered, you can apply sunscreen. And there are several products out there that are made specifically for children.